Mr. Speaker, I've asked a specific question, and I expected a specific reply from the Honourable Prime Minister. I asked whether we have strategic stockpile of the most important medicine and protective equipment. Because I listened to to a statement made by the Minister and by the Prime Minister that we don't have more than 30,000 masks. And we don't even know whether it is the N95 mask, which is protective, or other masks, which can allow bolus of infection, and therefore we know what the consequences are. So can I have this reply from the Prime Minister?
Okay, we have, in terms of medicine, I know we have presently a stock of from 6 to 9 months of essential drugs. I know, I am informed that there are further orders that are expected in the months to come, and well, then that is not relevant. With regard to equipment, we have at present what we call the personal protective equipment for those who are going to deal with such cases. Coverall, head to ankle, we have 5,400 available right now. We have nitrile gloves, surgical masks, surgical gown, reusable goggles, the goggles that you have to, it's a bit like the astronaut, you know, you have to cover your head, with 300, reusable face shield, 500. So we have a number of those equipment right now. And with regard to masks, there are 20,000 in stock, and 10,000 additional are being procured right now. So we'll be having around 30,000.
Before we move on to the economic issue, let me ask the Prime Minister in respect of contact tracing and follow-up. And this is where there is a loophole. Can I ask him, once a case is detected, whether we use the tried and tested procedure for rapid tracing, monitoring, and isolation of close contacts with the aim of preventing further spread? Can I ask him whether this is followed to the strict letter of the application of the protocol? Before I sit, Mr. Speaker, sir, I have here the action plan of the UK, and I would ask Prime Minister to obtain a copy of this action plan to understand fully the merits of taking all measures in respect of surveillance and monitoring.
Well, maybe I am more Mauritian, so I have the action plan of Mauritius. But I can lay, I will lay, of course. This is the operational plan, and this, Mr. Speaker, sir, has been validated by the WHO. And the thing is that we learn a lot, when you are faced with such threats and challenges. And I'm told that as the situation will evolve, and as there will be probably more understanding of this virus, of course, this is not something that is cast stone and it has to be, probably will have to be reviewed also, depending on new situation. So I will obviously ask, not myself, technical people to have a look at the operational plan of the UK. Surely there must be a lot of very good things in that plan. But the question was about I think you...
Contact tracing and follow-up of it.
Follow-up, yeah. Mr. Speaker, sir, I also was very keen to know that we have, in fact, a very effective and efficient system in Mauritius. Even before we have such kind of threats, we have, and I must say, even international institutions have shown and have admired our system here, where people who have traveled from countries where there are, for example, malaria and other diseases, we have a follow-up and we have them checked to see whether there is any illness. Of course, this is reinforced now with cases where we probably, if we find that there is somebody who has fever at the airport and coming from a country which is a high risk, is immediately quarantined. Somebody who has fever but who is coming from a country which is not a high-risk country, of course, there is this follow-up by officers of the Ministry of Health. And we have been monitoring a number of cases, I am told, and so far, therefore, there has been no confirmed case yet.
Honorable Leader of the Opposition, would you give way? One question to Honorable Jutim.
Thank you, Mr. Speaker, sir. I would like to know from the Prime Minister, Honorable Prime Minister, he's aware that all the experts are predicting if the virus continues to spread to pandemic levels, there would be many countries who would stop exporting their food stuff and keep it for themselves. And this can have an impact on Mauritius who are dependent on our basic food supply from external sources. So may I know from the Honorable Prime Minister whether he has approached our friendly countries to find out at a government-to-government level, if ever there is a blockade, that Mauritius will be exempted for the so that we can have sufficient amount of basic foodstuff in Mauritius.
Well, again, Mr. Speaker, sir, we do not know what is going to happen in the future. We cannot know right now whether we will be short of which commodity, for example. I agree that we do import a lot of our food requirements, for example, which is essential. Now, we have good relationship with a number of countries, but again, we must bear in mind, those countries are going to face difficulties themselves. So, whether we can eventually, should there be a shortage of one commodity, of course, we will do whatever it takes in order not to be short of supply, but then we must also be able to look at alternatives, substitutes also. And then there are certain things, well, we must face it. When one product is not available on the market, unless it is not the essential product, a necessity by itself, I think we can just try to mend our way of living, and we can try to cope, provided we are not starving. So let me say that also we are promoting with my colleague, the Minister of Agriculture, a number of initiatives that have been taken in the past, fortunately, but that will need to be taken again, and especially in the light of this situation, to promote local production. And that is also being looked very actively by my colleague, the Minister of Agriculture.